Bismillahirrahmanirrahim. Rabbe zidni ilma. Quote of the day. Life begins at the end of your comfort zone. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq and under the kind supervision of Professor Sarah Afzal. Today my topic of presentation is planning models, map and chip. Learning outlines include the introduction of planning models, map model, which is mobilizing for actions through planning and partnership. CHIP models, community health improvement plan, recent advances and multiple choice questions. At the end of this presentation, participants would be able to describe map and CHIP models. Planning models. Models at their core are extensive lists that describes a schematic approach to studying, interacting with, and change a system or situation. A planning model is also a paradigm, a way of thinking that serves as a template that includes a set of assumptions, concepts, values, and practices. Since a planning activity often brings together individuals with diverse backgrounds, interests, and agendas, agreeing on a model to follow during the planning and improvement process in one of the most important steps in the early stages of endeavor. Choosing a model. There is no easy formula or decision tree that would lead to the best choice model for a particular situation. Perhaps the best time spent early on in the planning process is to learn more about models for planning that are available. There is no one size fits all model, nor is there an evidence base that would suggest that one model is better than another. Starting with MAP, mobilizing for actions through planning and partnerships. MAP is a joint project of NACHO, the National Association of County and City Health Officials, and the United States Center of Disease Control, CDC. It is a model for improving community health system whose mission statement is communities achieving improved health and quality of life by mobilizing partnerships and taking strategic actions. MAP guiding principles include the systems thinking, dialogue, shared vision, data, partnership, strategic thinking, and celebration of successes. MAP's 6 phases are: first of all is organized for success, 2 is visioning, 3 is the assessment, and it is the hallmark of the MAP model. 4 assessments are there: community theme and strength assessment, local public health system assessment, community health status assessment, and forces of change assessment. Then comes the strategic issues, then goals and strategies, and last action cycle. Now you can see this is a MAP model, starting with the organized for success, partnership development, visioning, then 4 MAP assessment, which all are surrounding this MAP model. Then the identify strategic issues, then formulate goals and strategies, and the action. And action starts with the plan, implementation, and evaluation. And all these assessments will surround this MAP model, which is community themes and strength assessment, local public health system assessment, community health status assessment, and force of change assessment. Why use the MAP? MAP uses a participatory process. This model is based on partnership and collaboration among all relevant public health bodies and between the public health system and the community. The MAP process has been developed using information gleaned from previous planning efforts. MAP brings to bear 4 different assessments to get the clearest picture possible of community health issues and systems. The MAP model includes strategic planning. MAP helps the community to anticipate and manage change. It focuses on strengthening the local health system. It increases the visibility of public health in the community. The process creates government leadership on public health issues, and it takes a community perspective with the overall goal of creating a healthy community. Who should take part in and use the MAP process? Local and state public health officials and agencies, health practitioners, administrators, and others who are part of the local public health system. Then the first responders. Next, local and state elected and appointed officials, human service organizations, other community organizations, public schools, local colleges and universities and other education institutions, faith communities, business, community members, representing the diversity of ages, income, and the racial ethnic mix in the community. When is MAP appropriate? When a current or potential health issue surfaces, either in the media or among health practitioners, when there's been an issue or crisis that everyone agrees was not handled well, when there is a money available for health system and when there is no money available for health system, when the community is about to build a new health facility, and when there is a government push to re-examine public health or the local health system. How do you conduct a map process? Understand and use the guiding principles, which were systems thinking, dialogue, shared vision, data, partnership, strategic thinking, and celebration of successes. Phase one, organize for success. It includes the determine the necessity of undertaking the map process, identify and organize participants, design the planning process, design and begin the evaluation process, determine the resources you will need for the planning process, make sure the community is ready to conduct a successful planning process, develop a management structure for the process. Phase two, which is of viewing, identify other viewing efforts and make connections as needed. Design the viewing process and decide how it will be managed. Then conduct the viewing process. Formulate vision and value statement. Keep the vision and values alive throughout the map process. The assessment. Conduct the four assessment. It is the basic hallmark of the map model. Four assessments in phase three. First is the community themes and strength assessment, the local public health system assessment, the community health status assessment, the forces of change assessment. Phase four is of strategic issues. Brainstorm potential strategic issues, develop an understanding of why an issue is strategic. Determine the consequences of not addressing the issue, then consolidate overlapping or related issues and arrange issues into an ordered list. Phase 5 is of goals and strategies. Develop goals related to the VN and strategic issues. Generate strategy alternatives. Consider barrier to implementations. Consider implementation details. Select and adopt strategies and draft the planning report. Last phase is of action cycle. It has three phases: planning, implementation, and evaluation. The first stage is planning for action, organize for action, develop objectives and establish accountability, and develop action plans. Second stage is of implementation, review actions, plans for opportunities and coordination, and implement and monitor action plans. And the third stage is of evaluation of phase 6. Prepare for evaluation, focus the evaluation design, gather credible evidence and justify conclusions, share lessons learned and celebrate successes, and keep at it indefinitely. As you can say, it is the map, your community roadmap to health. First, starting with the RVN. As it goes forward, there were four map assessments: community health status assessment, local public health status assessment, and all this assessment for then moving towards forward. Identify strategic issues which you are facing them, then formulate goals and strategies according to the issues. Then comes the action cycle, which includes a plan, implement, and evaluate. And then ultimately it leads to a healthier community. Moving towards the next model, community health improvement process, that is called CHIP. What is a CHIP? A CHIP is a community health improvement process that can also be used for building a healthy community. CHIP is slightly different from other similar processes in that it incorporates accountability in the planning, implementation, and evaluation of the community health improvement efforts it fosters. So it is very important in the CHIP models that it incorporates accountability in the whole process. Why use a CHIP? It takes a community perspective, it's inclusion and participatory, it demands a comprehensive view of health. It sees equity as key. It's flexible. It builds in accountability. It builds in performance monitoring. It can incorporate or fit in with other models. It sees the process as ongoing and long-term. Who should be a part of CHIP? Those who are directly affected by the issue at hand, those whose lives or jobs will be affected by the CHIP effort, change agents, influential people, and the community members at large. How do you implement a CHIP? Incorporate Institute of Medicine, IM's journal guidelines. Institute of Medicine is a non-profitable organization in United States which deals with the implementations of the policies, helps with the policies and strategies related to the public health. So the guidelines include define health broadly, develop specific quantitative measures, and hold responsible groups accountable to them. Balance long and short term goals. Include all stakeholders and other potential contributors to the work in assessment, planning, and implementation. A chip should be centered in a community health coalition or similar entity. State and local public health agencies should assure that the community health improvement process is in place in all communities. State health agencies, in cooperation and collaboration with local health departments, should assure the availability of community level data needed for health profiles. States and the federal government should require that appropriate private entities report standard data on their enrolled population to facilitate the chip. Form an inclusive participatory coalition or coordinating groups or tie into one that already exists. Do your research. Identify the issues you are going to work on. Analyze the issues carefully. Take stock of potential resources, particularly those already available in the community, and develop a strategic plan and actions plan to carry it out. Agree on who will be accountable for which part of the plan. Work out how accountability will be monitored. Implement your strategy. Monitor both the process and outcome of your effort. Maintain your gains. Start the cycle again with another issue. As you can see, it has two cycles: problem identification prioritization cycle, which has 3 phases, and second is analysis and implementation cycle, which has 7 phases. In the problem identification and prioritization, we form community coalition, prepare and analyze community profile, and identify critical issues. This is the phase which goes like this. And then comes the analysis and implementation cycle, which is the first to analyze issue, then the inventory resources, develop strategies, identify accountability, develop indicator set, implement strategy, monitor process and outcomes. So the problem identification cycle focus on bringing community stakeholders together in coalition, monitoring community level health indicators, identifying specific health issues as community priorities. Community health improvement process, 2 cycles, as I have told you, these are all the health issues which are under consideration. So there are 2 cycle: problem identification, prioritization, and analysis and implementation. Emphasizes ongoing nature of community improvement process. So it's the healthy neighborhood and healthy communities. Neighborhoods are where we live, and communities are how we live together. So safe, reliable, affordable housing, friends and support, access to healthy food, ways to get around, equitable access to resources like schools and hospitals, and value and celebrate the diversity. Moving towards the recent advances. This is Community Health Improvement Planning Handbook. In this book, what is a community health improvement plan? It is the roadmap for improving public health system performance, improving population health, and keeping community health planning visible to local decision makers and communities. It lays out a long-term strategic effort to address a public health issues based on the community health assessment results. So CHIP is developed after community health assessment and priority setting process through a consensus process involving members of the community partner organizations and health department. So developing a chip represents a natural output of the community health assessment. As you can see in this picture, community health assessment include a health department plus community stakeholders, hospital community groups, etc. Then a chip comes, health departments are community stakeholders, hospital community groups, and then there are the strategic plans related to health department, hospital, and then the community groups. Healthy cities and healthy communities generate a VN. Then assess assets and resources and barriers. It is very much essential because resources are required, assets are required, and there should be the notification of the barriers. Then the prioritize issues. Develop a community-wide strategy. Implement the plan. monitor and adjust your efforts, establish new systems to maintain, build on your gains, then celebrate benchmarks and successes, tackle the next issue, assemble a diverse and inclusive groups. And this cycle then, now it goes on. Then the Community Health Improvement Plan CHEP is 2020 to 2022. In this, it is the second part of the two-part health improvement planning process. The first step was completion of 2019 community health assessment, which evaluated health status and issue impacting Montgomery County population. Representatives from the variety of organizations throughout the country. Then it means in 2019, community health assessment was done, and then after that, CHIP was introduced for 3 years, 2020, 21, and 2022. So it was the Community Health Improvement Plan, a healthy, safe, and thriving community. The priorities of goal of this CHIP models are the maternity and infant vitality, chronic disease prevention, and the behavioral health. As you can see by this, maternal and infant fertility, chronic disease prevention by increasing the physical exercises, and the behavioral health, including the physical and main stress on the mental health. It is one of the article on the mobilizing for action through planning and partnerships map resource guide for disability inclusion. And this, the purpose of this resource guide is to provide guidance on how the map process can be inclusive of people with disabilities. The goal is for health department to have the tools and resources to actively engage people with disabilities and the agencies that serve them in a map process, particularly for inclusion effort to support community health assessment and development of community health improvement plans. And on the same lines, they have done the first of all the introduction of the way what is disability, models of disability, data, and the health inequalities, and then the 6 phases. First is organize for success, partnership development. Next is the vision. Third phase is community health status assessment, which is the 4 assessments of the map. Then the phase 4 is to identify strategy issues. Then the phase 5 formulate goals and strategies, and the phases is of the action cycle. So how this is being carried out. Now moving towards the multiple choice questions. First question is, MAP process is centered on community organizing and partnership development. It has 6 phases. Which one of them is distinct phase with 4 assessment? Phase 2, 3, 4, 5.
Phase 3.
Yes, the correct answer, phase 3 is with 4 assessments. The basic philosophy of MAP of community participation in planning and implementation are like other models, but it is distinguished from other models by the planning phase, implementation phase, assessment phase, and evaluation phase.
C.
Correct answer, because C, assessment phase, is a hallmark of the MAP model. Mobilizing for actions through planning and partnership was developed by Nature and CGC, and it was built on the foundation of PATCH, MATCH, APXPH, PACEH.
C.
No, C is the correct answer. C, APEX-PH is the assessment protocol for excellence in public health. And it is a method for comprehensive public health planning that can be implemented by state and local health departments. So third is the correct answer. MAP is targeted to communities, and its goal is to equip them with the structure framework for planning health programs. In its third phase, it conducts a 4 assessment. Which of the following is not its assessment? Community themes and strength assessment, local public health system assessment, the forces of change assessment, environmental assessment.
D.
Yes, D is the correct answer. It is not the part of the assessment. In phase 6 of MAP, which is an action cycle, includes all which are given below except partnership, planning, implementation, and evaluation.
A.
Yes, the correct answer is A, partnership, because in the action cycle, planning, implementation, and evaluation are the parts. Question number 6. CHIP model of community health improvement is a framework for a process for building community health and is developed by IOM, NACHO, CDC, and WHO.
A.
Yes, A is the correct answer. It is the Institute of Medicine. The Institute of Medicine is also an independent non-profit organization that works outside of government to provide unbiased and authoritative advice to decision makers and the public. CHIP has two interacting cycles. First one is problem identification and prioritization cycle. It includes all except identify health issue, prepare and analyze community health profiles, form community health coalition, develop health improvement strategy.
D.
Yes, D is the correct answer because in the first phase, strategy is not the part, it's the problem identification phase. Question 8. CHIP has two interacting cycles. First, the problem identification and prioritization cycle, and second is analysis and implementation cycle. Second cycle includes how many phases? 6, 7, 8, 9.
A.
A.
No, it has 7 phases. 7 is the correct answer. B. 9. CHIP cycle of analysis and implementation has 7 phases. Which one of the phases is related to concepts of asset-based community development, identifying strengths on which to build and ultimately address health problems and needs, analyzing health issue, inventory resource, develop indicator sets, monitor process and outcomes.
B.
Yes, B is the correct answer, inventory resources, because it is related to asset-based community development. Last but not the least, a CHIP is a community health improvement process that can also be used for building a healthy community. CHIP is slightly different from other similar processes in that it incorporates policy, regulatory, organization construct in education and environmental development, accountability into the planning, implementation, and evaluation of the community health improvement efforts. It fosters health goal selection, intervention, planning, development, implementation, and evaluation, and the community mobilization, collect, organize data, choose health priority intervention, and evaluation.
B.
Yes, B is the correct answer because accountability in all the process of planning, implementation, and evaluation is the hallmark of the CHIP model. This is my key, and thank you so much.